The Personal Health Budget Pilot Scheme is to find out and test whether personal budgets within health are beneficial for our patients and also for the NHS. We are much more informed about our health, we understand our health a lot more, and actually we want that control.
It allows them to take control, it allows them to become much more part of society rather than the traditional medical model of management. They're able to set their goals, which often are very different from the traditional medical goals that we have.
They have a choice to purchase the services they feel will help them achieve their outcomes. They take responsibility and accountability and they comply to whatever choices they've actually chosen, and that will in turn stop them actually accessing other services.
The most important thing about a personal health budget has been giving the onus of control to the service user. It's handing over control of what's important to you.
It's more the service users are in the driving seat saying, this is what I want, this is what I need to get myself well and get myself to that goal.
They're not for everybody. Not everybody wants that amount of choice and control. But I think in the arena of personalisation and self-management, there are a lot of people that actually, if approached in this way and given the opportunity, will want a lot more choice and a lot more control in the way that they actually improve their own health and well-being.
I knew that the NHS do not offer long-term open-ended psychotherapy. Jackie came up and had found that there was this pilot scheme going on.
Mary has for probably 3 or 4 years asked for counselling, and we were unable to secure the counselling that she wanted for the length of time that she wanted. Mary didn't want anything that was going to be a set period of time. Mary wanted to be in control with the fact that I want counselling when I want it, when I need it open-ended so that I can work at the pace that I want to work at.
We identify patients by asking clinicians out in the field working with their patients who they felt would benefit from this new approach. We assess the patient and their needs, and from those needs we can then identify a budget for them. The next step in the process is actually identifying the indicative budget. They have to understand how we've actually come to that amount of money. But in most cases during the pilot, we found that actually that indicative budget hasn't changed. The personal plan that a patient writes with support is really the key to actually making everything work, and that will actually help them improve their lives and their well-being. It's important that the patient themselves, that they actually write this plan themselves in partnership with their clinician.
We started off very much talking through what he valued, what he felt was important in his life, what he felt needed to be different, what he wanted to achieve. We've negotiated what he feels is important to him in terms of his needs from a therapeutic perspective, and got to a point where we had a plan that he felt was representative of him and his needs.
It was quite a long build up to it before we actually got a green light to sort of, go ahead and give us your submit your plan.
One of the top outcomes in people's plans that they've put in themselves is that they want to use less of health services, particularly they don't want to have to go into acute care. It hasn't helped them in the past, and so therefore they want to choose other services that are actually going to help them. We have to agree the plan that the patient has written and that the clinician has already agreed. Patients and or their representative can choose 3 different methods of managing the money. They can have the money as a direct payment. This means that the budget is paid directly into a separate bank account. They sign a legal contract around this. Basically, it's the patient or the representative saying that we will spend this money according to our plan. The second way of managing the money is for a third party to actually hold the money on their behalf. So quite often people use a voluntary organisation, a social enterprise or a charity, somebody like that. And then the third way is that they leave the money with the primary care trust, or soon to be the clinical commissioning group, and they actually spend the money on their behalf according to the plan.
The service user I worked with felt he could manage that budget, which was fine, and it's having that choice.
They gave me a lump sum and I give her a cheque every week. It rolls very easy. I have a separate bank account and that's where the money is. I can see exactly what's been spent and how much is left.
So the final step in the process is the monitoring and recalibrating. So in other words, we're monitoring that people are actually spending the money according to their plan. And then the other part of that is the monitoring of whether they're actually meeting their health outcomes within their plan. If they're not, do we actually need to say to them, do you want to look at the plan again? Perhaps what you're buying is not quite the right thing, and perhaps we need to change it again and look at trying something else. And then the recalibration part of it is really if somebody's health needs change. So if somebody becomes very poorly, or on the other hand, if they make a lot of progress, do they need all the money for buying those services? Do they still need those services? And on the other hand, if their health needs are increasing, do we need to increase the budget, and do they need to buy more services?
But once you've tried something and it's working and it's making you better, why not increase whatever it is that's making you better? I have problems with my coordination, and rather than somebody making me do something, do something that you want to be doing. So bash away on a set of drums.
There are lots of things out there that you can buy in to make your life easier and better. Things like respite, a break, fuel to get to psychotherapy.
I drive now, and I was concerned about driving because I'm afraid of my short-term memory, I do get lost. So the health budget bought me a sat-nav, which has been invaluable.
This change to working in partnership with our patients is a complete culture change. I mean, these are patients who have a long-term health condition. They've lived with this for a long time and they will live with this for the rest of their lives. So they are in a way just as expert about knowing what they need as the health professional is. Health professionals that have worked in the pilot and have begun to understand the benefits of it have realised that it's not a threat to their job, it's just a different way of working, and it means that they can actually spread their service to a wider customer base.
If we go on delivering the same services that we have done in the past, we're actually going to get the same outcomes, and I think most people will accept that those aren't satisfactory. The evidence coming out of the personal health budget is that those benefits are realised very quickly, and the gains both for the clinicians, patients and health economies come at a rapid pace.
Initially, when it was introduced, there was that concept that all the assessors felt that's a lot of work, additional work from the work that we're already having now. Myself, because I had the desire and the passion that if it can change even one person's life, I think I would rather do that and improve somebody's life.
The only barriers to this approach going forward is the element of it being different to conventional services, and of course it's new, it can be seen as less clear about what a health need is in comparison to a social care need, and there's obviously some grey areas that need clarifying.
We have to identify what are the things that allow people to lead a better life. Now, those will be technical solutions that health can provide, but also with the personal health budgets, there'll be organisational solutions to allow people to set their own goals. It's not cost cutting, it will save money, but at the same time it'll increase the quality of the care that people are experiencing.
At the moment, you can't see the immediate savings, but you can see the reduction of clients accessing other services and reducing the budget on those on the organisation.
It's giving our service users an awful lot of confidence. It's decreasing social isolation, and it stands a good chance of succeeding because they are in control of what they want. They are buying their own services, and because it's what they want and they're not being told it's what they've got to do, they stick with it. The other thing that I've learned is how much money has been saved this year. The things that Mary is not using at the moment, she's not using the home treatment team, she's not using hospital services, and that has given Mary a real sense of achievement, which has increased her confidence. Over the months, when I saw how Mary's mental health improved, how the other person that I've been working with, confidence grew, that they are actually achieving goals and aims in life that they've been struggling with over the past 3, 4, 5 years, I couldn't believe it was possible, the strides that both of them have made, and I'm so impressed.
My relationships with other people, especially my family, have greatly improved, and all these things have made such a difference to my life and to my family's life.
The learning point from the pilot is that it's possible and it's successful, and I think that people who've been involved in the pilot need to preach that to other people. We need to work in a much more joined up way, and we need to blur the boundaries between primary, secondary and mental health so that people experience care in the right way wherever they enter the system, and it doesn't depend on you having a particular condition at a particular time in front of a particular clinician to be able to get a personal health budget. But these are overcomable. These are all the things that will make a difference in the future to providing care. It works for people, it's successful, and it saves money.
For the service user I worked with, there was a strong element of him needing to find meaning and purpose to his life, and the personal health budget actually provided that. It provided him with a purpose. When I first met this man, he didn't feel he had choices. He felt helpless and basically redundant, and that was driving this cycle of depression. And he was able to step out of that and feel more empowered.
I used to have a purpose on this planet, and then all of a sudden that was taken away. And now I have been given another chance to help other people, people less fortunate even than me. Now that's given me a real sense of well-being, and to be able to help somebody else, it's a reason for living. 12 months ago I couldn't see a future, and the personal health budget has given me a bit of a glimmer of hope. You know, that there are things I would like to try.
Mary's had quite a stressful year with a number of things that's been going on in her life. Now last year she wouldn't have been able to cope with that. We'd be looking at hospital admissions, we would be looking at a various number of overdoses, we would be putting in extra services, either crisis intervention, home treatment, we'd be looking at respite care, hospital admission. Since they had personal health budget, all that dependency has stopped, and Mary has grown in confidence. She's in control, she's in the driving seat, and Mary is getting the service that Mary wants. It's tailor-made to her.
A year ago, I couldn't see an end. well, I could. It would have been a death. Now I can see that I've got a life to live now, and it's the best thing that ever happened to me, and I just can't recommend it enough.